My name is Anab Abdullahi. I'm a caseworker cultural mediator for Somali-speaking patients in here Harborview Community House Calls. I've been working in community house calls for 20 years. Part of my job is what I do is case care coordination, advocacy, navigation, education, and interpretation since I work Somali patients. I was called a young Somali man who had a stab on his chest. I went to see the patients. I introduced my role as a CCM, and the patient was pleased to see someone who speaks his language. I asked permission if I contacted, if I can find his family, and I put the patient's father on the phone, so to listen also. When the patient hears his father's on the other side of the phone, he was very released, and the father told him to do the surgery, and finally he agreed. And the surgery was done, and that was very successful. This is classic example why we need community house calls, CCMs, to get involved patients in early on. Patient's condition could get worse, and that will inquire for long ICU staying that will burden in the system. First of all, I built trust relationship with the patient. Second, I made the communication to be clear, both the patient and also the team. There, I advocate for the patients about understanding where he's coming from, and also advocated for the team to let the patient know why the concern that the team has it. There, I educated the patients, explaining exactly what is the outcome if we've not done this thing, this situation. And another thing is also saving resources for the hospital. Somali patient comes to the ICU or other part of the inpatient's hospital, they are fearful or they are scared about in the hospital itself, and not speaking the language, not knowing the culture. That's where the cultural mediator come. And when the cultural mediator, what we do is we reduce their pain and also their fear they have, because here they have somebody who speaks their same language, that shares the same language, culture, and religion. And then what we do is we held their hands during their hospital stay and also after. My work is involved human lives and helping those who's very vulnerable. My takeaway when I go home, it is I know that I made it somebody's life that day a little bit better.